If you've been dealing with ongoing heel and foot pain that doesn't seem to be getting better, this video is for you. In this video, I want to explain to you, in layman's terms, the anatomy and physiology of plantar fasciitis, and if it's the pain that you're experiencing. Before we get into it, consider liking this video and subscribing, because that really helps support our channel. So, the term plantar fasciitis is actually a little misleading. It doesn't always mean it's associated with inflammation. The technical term is plantar fasciopathy, or a degenerative condition of the plantar fascia. So what does this actually mean? All right, everything goes back to anatomy. So let's start there and get a lay of the land, or the foot in this case. The plantar fascia is a thick band of connective tissue that spans from the ball of your big toe to the inside of your heel bone. And it has a few very important major functions. One of those functions is to provide arch support, and it provides a solid but flexible structure to the foot, kind of like a sling structure like a bridge would need. The other major function of the plantar fascia is force transmission, and how this works is actually a really cool mechanism. Because of where it attaches at the ball of the big toe, whenever we take a step and that big toe extends back, that stretches the fascia and basically turns it into a high-powered spring. This aligns our heel bone in order to propel us forward with a lot more power and a lot more force. So that's the normal mechanism. That's what's supposed to happen. But what happens when that doesn't happen? If something along this chain of events isn't working properly or pulling its weight, all of the stress of making contact with the ground goes to the plantar fascia instead of through it and up the kinetic chain. Over time, this can lead to overload and pain. And if that tissue continues to be overloaded, it can result in a thickening and weakening of that tissue, which prolongs the healing course. So, how do you know if you have plantar fasciitis? There are several tests that we perform in the clinic to diagnose this issue, but there's also several common signs and symptoms that can point to whether this is the issue you're dealing with or possibly something else. The first thing to look for is, where is your pain located? If you can pinpoint the most sensitive area on your foot right at the base of the inside part of your heel, it's a dead ringer for plantar fasciopathy. Another telltale sign is what's called first step pain. This is where you experience a very sharp stabbing pain in the heel when you go to rise out of bed in the morning or get up out of a chair after sitting for a long period of time. It almost feels like a nail in the base of the heel. Another common theme that we see, and is ultimately one of the primary causes of plantar fasciitis, is tightness in the calf and the ankle joint. Tightness in this area can stem from a variety of sources, including disuse, an old injury, or weakness in the calf and ankles. The last question you can ask yourself is whether you've had a recent increase in your activity level. Typically, itises don't just fall from the sky and hit us in the foot or the elbow. They're driven by overuse. As physical therapists, we often see this in our patients who have spent more time on their feet. Maybe you went on vacation where you were walking more miles than you normally do, or you started a new sport like pickleball. Sometimes it just happens. If you can check some or all of these boxes, you can be reasonably confident that plantar fasciopathy is what you're dealing with. But luckily, there's hope. There are lots of tools and tricks you can use to help resolve this issue on your own. Now, don't expect to get rid of this right away, especially if you've been dealing with this for a few weeks or more. It is one of the most stubborn issues that we treat, but consistency is key. For more information on how to deal with injuries like this, check out some of our other videos on our channel, like this one. Till next time.